today we will see about for today's class, we will see about the post-operative care. Okay, so when we say post-operative, so it is a time period which is after the surgery of the patient. Okay, so suppose the patient have already done his surgery. Now, what happened after the surgery? We will send the patient to the recovery room. So here, the most of the care which involves in the post-operative care, it is occurred during in the recovery room. Okay, we call it at the post-anesthetic room or the recovery room. Okay, so during that period, the so many things need to be we need to observe the patient and very closely. We have to observe the patient because immediately after surgery we don't know, okay, so many complications, it might happen so suddenly. And also this recovery room, it is always attached near to the OT, so that if anything, if any untoward complication occurs, or if any sudden changes occurs in a patient's status, so we can send him immediately for any form of emergency treatment. Okay, so I will be sharing my slides. Okay, is it visible? Yes.
Yes, ma'am.
Okay,
Yes,
so
ma'am.
today we will see about the post-operative care. Okay, so this is actually a very crucial period, like I said. So we have to always keep the patient in a very close observation, especially during the first day. Okay, so in the first day itself, because that is immediately after the surgery, so that day itself is very crucial for the patient, as well as we have to keep a patient very in a very close observation. So actually it begins, if we say post-operative phase, okay, it begins with the admission of the client to the recovery unit. Okay, so this is also called as a recovery room. Even in a hospital, we have it as a recovery room. Okay, and it continues till the healing is complete, or until the client he's received a follow-up evaluation at home or is discharged to a rehabilitation unit. Okay, so our main aim in actually in post-operative phase is to ensure that the patient will recover as early as possible. That means he will have less pain, less discomfort. Okay, we will try to help him to regain his normal functioning again. So this is actually done during the post-operative phase. Okay, so we will keep the patient, so we will take care of so many aspects. We will take care, be it the diet, we will take care of his diet, we will take care of his stress, sleep, okay, his hygiene, then his wound. Okay, since the patient, he will be going for surgery, so obviously he will have wound. Okay, so we'll take care of the wound, so we will take care of his so many other aspects. Okay, so in post-operative care, it includes all this. Okay, from the admission to the recovery unit, and it continues until the patient heals. Okay, so once the patient, okay, it depends also on the particular type of surgery done. Okay, some type of surgery we will keep the patient only for 1 day in the recovery room, then we can shift him to the ward. Okay, so to his own ward. And sometimes, depending on the situation, some patient we keep them for 2 to 3 days depending on the condition. Okay, then if they are a bit stable, then we will send them again to their own specific ward or their own cabin. Okay, again, in the cabin they'll be staying for a few more days. After that, if they are a bit okay better, so the patient, we will discharge them. And after that, before going for discharge, again we will give them some form of follow-up care. That means when they have to come back, what are the medicines that they should continue to eat, okay, what type of diet they should have. So all those will be done overall in the post-operative phase. Okay, so the main aim of actually post-operative care is to provide the patient with a quick, painless, and safe recovery from the surgery as possible, because immediately after the surgery, okay, the patient will be having a lot of pain. So mostly everything, and everyone and whoever comes out of surgery will be having a lot of pain. So we will try, even though pain will be there, okay, we'll try to minimize his pain. We will try to give him comfort, okay, and we will make sure that he recovered in a very safe manner. Okay, from whatever surgery he is having, so he will be having a very safe and sound recovery. Okay. So the main goals, if you say, okay, the overall goals of a post-operative care or a post-operative phase is to restore hemostasis, okay, or to maintain the balance and prevent any form of complication. Okay. Then to maintain adequate cardiovascular and tissue perfusion, okay, this is related to all your cardiovascular systems. So be it the patient blood pressure, okay. So we'll try to make the patient should have a normal blood pressure, okay. Then to maintain adequate respiratory function. So that is because patient with after the surgery they might have some respiratory dysfunction, like they might have decrease in the oxygen supply in the body. So for that we need to give them some oxygen, and also we'll try to maintain his respiratory function. Maintain adequate nutrition and elimination, okay. Then to maintain adequate fluids and electrolyte balance. Then to maintain adequate renal function, which means your kidney function. That means what comes here is the urine output and all. Okay, so the patient should have the normal urine output. Then promote adequate rest, comfort, and safety for the client, okay, during his post-operative period. Then we have to help the client in promoting adequate wound healing, okay. Then promote and maintain adequate activity and mobility. So activity and mobility, we will not, depending on the patient's situation. So we will not try to force the patient to do, because but however he can do, we will try to give him some form of active exercise where the patient he can do by himself, or passive exercise. Passive exercise means we will help the patient perform some forms of exercises, or even the physiotherapist also, they will help the patient in mobility, okay. Then to provide adequate psychological support, okay, especially if a surgery undergo any form of ambulation. Suppose a part of his limbs is being removed, or a part of his arms or anything. So that type of surgery, it will really affect the person psychologically, okay. He will might have depression because it's affecting his body image, right? Yes or no? Because his limb has been removed. So so many aspects, we have to always provide psychological support to the patient as well as to the family members, okay. So these are actually the overall goals of post-operative care, okay. So this is actually just some of the goals which I have set only. So our main whatever it is set. So what this is the same thing. So first thing, we will maintain the cardiovascular function. So here we will see early ambulation. Ambulation means we will try to get the patient out of bed as early as possible, how much he can do, okay. Because the patient, even though he might be post-operatively, he might be coming from the surgery or from the OT, but still we should not keep the patient stable, okay. We should try to help him to move around, even simple, even while doing, suppose even a simple changing of the bed sheet. So we will try to tell the patient to turn how much he can. So that is also a form of ambulation or activity, okay. So we will try to involve the patient or to keep him stable. Then activity tolerance, okay. So we'll try to help him to be able to do his daily activity by himself, or if not, then we'll try to assist the patient. Then hematocrit, that means it involves all the blood values, okay. So also many blood values will come here. Then the skin color is important because if the color, if it indicates bluish discoloration, so that is an indication that the person have a very less amount of oxygen in the body, okay. And for that we usually check the nail bed. So in the nails we usually see the color. So normally those person who doesn't have any decreased oxygen and all, we have a slight pinkish color, okay. But if the person, if he's having any form of decreased oxygen supply in the body, then the nail beds, it changes to bluish discoloration. So whenever we see that, we can know that okay, the person is having less oxygen supply. So based on that, we will try to increase the oxygen saturation by giving oxygen, okay. We can give oxygen by mask, okay, via the oxygen cylinder, okay. Then we'll also try to maintain fluid and electrolytes. In this we will try to take out what are the intravenous fluid, okay, how much fluid the person has been taking, okay. Then if the person is allowed to take orally, we will tell him to drink as much as he can, okay. So this is also depends, okay. We usually it depends on certain surgeries also. If it is not in if the patient, if the doctor allowed, then we can give, okay, orally. Then electrolytes also, okay. The all the electrolytes means so many things comes here: sodium, potassium, okay, calcium, so all these. Then your GI means your gastrointestinal drainage, okay. This also, it depends if the person have any surgery in the stomach, so this will come. Then renal function, the laboratory values, so many laboratory values also of your all your electrolytes values and all. Because all these electrolytes, how we will know the value? By taking the blood sample and all, okay. Then comfort. When we say comfort, what comes is analgesics. Okay, so analgesics, these are what drugs? These are those drugs which helps in relieving the pain. Okay, so immediately for every patient, whoever comes out of the surgery, the doctor will always prescribe the analgesics because obviously the person will have pain. Okay, and some patient they will have a very severe pain. So depending also on the types of surgery done. Okay, so the doctors will prescribe the analgesic or the painkillers. Antiemetic is those drugs which are given to reduce vomiting. Okay, because sometimes what happen, because of some medication side effects or so many other problem, the patient might have vomiting. So in order to reduce that, the doctors, they usually advise us antiemetics drugs. Then we will try to help the patient in maintaining hygiene. Okay, hygiene is very important. Okay, so if the person is not able to do it by himself, then we will assess him. Okay, then we also will help the patient in changing position. We should not keep a patient stable in one position. Okay, so we will try to change the position. If the patient can move, then we'll also tell him to move as much as he can. Okay, if it is not restricted by the doctor, then we'll also advise the patient to take adequate rest. Okay, then the respiratory function, then we'll teach the patient how to do coughing and deep breathing exercises. This really helps. Okay, and it also helps in relieving anxiety and all by doing some breathing exercises. Then disinfective spirometers. Okay, this actually, it really helps in the respiration if a person have any respiratory problem and all. Okay, this I'll show. I don't have the photograph now, but I will show you later. Okay, then also we will try to maintain nutrition and elimination. So here what comes is we will try to make sure that the person will have a normal bowel movement. That means he should be able to have normal bowel elimination. Okay, then he should also have, then depending on the situation, if the person is not allowed to eat orally, then he will be giving some IV fluids or intravenous fluids will be provided if he's not allowed to eat. And also we have to assess the fluid tolerance. That means how much the patient can drink. Okay, and if the person, suppose if he's having vomiting, then we will not give orally because whatever he take, he might vomit it out, right? So we will try to give intravenous fluid. So this intravenous fluid, we will give it through the peripheral vein. Okay, through the veins. Then also we will usually, for the diet, we always start with semi-liquid. Okay, semi-solid. Okay, and if the time by time, as the persons becomes start healing and all, then we can proceed to normal diet. And this also, it actually depends on surgery to surgery. Okay, what type of surgery done, and also depends on the doctor's order. Then we have to also record the BMI. Okay, that is a body mass index. Then we have to assess also the output. So all these are actually some of the overall post-operative care goals. Okay, so, and whenever we talk about post-operative care, the first thing which always comes is the respiration. Okay, because that is a very important thing. Because if the respiration fail, that means the person might even die. Okay, so we always first thing, whenever we talk about post-operative care, the first thing is the respiration. Okay, respiratory function. So, so next we will be seeing what are those are some of the goals. Okay, whatever I have mentioned, these are the overall goals which we have to do in a post-operative unit. Okay, so what are the nursing care which we will do for a patient? Okay, after the surgery. So first of all is a preparation of the post-anesthetic bed and the reception of the patient. Okay, so before a person will come back to the recovery room from the OT, so we have to keep everything ready. Okay, so whatever a machine is needed, we have to keep it on the side. Then if we need monitoring equipments or your fluids for giving to the patients, all those should be ready. Okay, so we have to prepare the bed to receive the patient, and we have to receive the patient without disturbing the devices, because when a patient comes to the recovery room, he might be attached with so many different form of devices. Okay, so we have to make sure that whenever we shift the patients, so all those should not be disturbed. Okay, so we have to shift the patient in a very proper manner. Okay, so no disturbance should be there. Otherwise, it might, so many complications again, it might occur. Okay, then we have to check the vital signs. I think by now everyone knows, right? What is the vital signs? It includes your temperature, pulse, respiration, and the blood pressure. Okay, so these are very important. So we have to always check the vital signs. Then we have to check the color of the skin and the nail beds for any cyanosis. If you see from the diagram, okay, so this person, if you see the nail beds, it is having a slightly bluish discoloration. Okay, so if the person have like this type of color, so this, it indicates that the person is having decrease oxygen supply in the body. Okay, so we should start with the oxygen therapy or the oxygen inhalation. Okay, then compare with the baseline data. So when we say baseline data, it's like suppose a person already before the surgery, okay, they will check the vital signs, and again after the surgery also they will check. So they will try to compare, okay, whether any specific changes is there or not after the surgery, whether whether his blood pressure goes up or goes down after the surgery. So that is called the baseline data. So we always compared with the baseline data, it really helps to know whether the person is improving or his condition is deteriorating. Okay, so we have to always compare with the baseline data. Then we have to check the operation site for any bleeding. Okay, this is important. Okay, so we have to check if there is any form of bleeding from the operation site, any form of discharge. Okay, and if the drainage tube is fixed. If you can see in the diagram, okay, that is called a drainage tube. Okay, so whenever a person comes out with the surgery, so this we usually keep it. So it helps in draining out all the blood, okay, all the fluids, okay, from that operation sites. So not all patient who undergo surgery will need this drainage tube. Okay, it depends on the type of surgery also. Mostly person who undergo any surgery in the chest, okay, or anything who have person who undergo any surgery in the like related to orthopedic and all, okay, so or to the bones, so they will need this. But not every surgery requires this drainage tube. Okay, keep the patient well covered. Okay, and never leave the patient unattended. This is very important, because what happened if you just leave the patient unattended, okay, he might even fall. Okay, so that is actually called as in the legal, it is also under the legal issue, okay, for nurses. So that is, if you leave the patient unattended, it might cause fall injury, and later on it might also cause so many complications. So that is the main reason we always have this side rails. Okay, so if you see from that diagram, okay, in the bed, that side, okay, so those are called as the side rails. Okay, so we should always keep the side rail up, because if you don't keep it, because patient after the surgery, some might become very restless. Okay, so and we don't know also, because the patient is totally unconscious. Some of them, they are still having the effect of anesthesia. Okay, so they are not aware, so they might just even fall down, or so many things can happen. So we should always be caution, and we should always be with the patient. Okay, observe the patient for swallowing reflexes. Okay, and if it is not present, then we should always keep. And this is actually very important, especially to those patients who come out from the OT, okay, with a general anesthesia. Okay, because as you remember, if you remember, I've talked about general anesthesia. It affects the entire. Okay, so when we give general anesthesia, the entire body is involved. Okay, so everything becomes relaxed, the muscles and everything. So that's why we never usually allow the individual, okay, especially those who come after the general anesthesia, we always keep them in a side lying position. So if you see from the diagram, so it can be right or left side. So by why we keep them in side lying position, it helps in draining out if there is enough any fluids. Okay, because if you don't do that, then it might cause aspiration. Okay, so that means some fluids might enter into the lungs and might cause so many complications, even death. Okay, so we should always keep the patient in a side lying position, so it helps in draining out the fluid, as well as it helps in preventing any tongue, because even if a tongue falls back also, it can cause obstruction of your airway. So our main aim actually in post-operative care, it is to maintain a clear airway. Okay, so that's why we should always keep the patient in side lying position. Okay, and after tonsillectomy, okay, so this is a surgery done for removal of the tonsil. Okay, so this, when the person comes with that surgery, the patient should be keep in a prone position. Okay, if you see from this first diagram, that is a prone position where the face will be down. Okay, so why we keep them like that? So likewise here also we will keep them like that, so that whatever fluid is there, it will be drained out, and to avoid any form of aspiration into the lungs. Okay, so observe the functioning of all the devices, very important. Okay, so we have to make sure whatever equipment is attached to the patient, be it your cardiac monitor, okay, be it any machine, be it your intravenous fluid infusion. So all those should be in a proper functioning. Okay, there should not be any form of blockage or any dysfunction. And make sure they are in functioning order. Okay, check the doctor's orders for any other instructions or treatments. Okay, so all those we have to always check. So even in the doctors or in the patient's ticket only, we usually have so many we maintain many records and all. Okay, so this So this is actually what are the immediate post-operative recovery or in the recovery unit, what you need to do. So like I've already mentioned, the first thing which is always important we have to do is the respiratory status. Okay, so always we have to make sure that the patient will have a clear airway. So how we will do that? We will by keeping the patient in a side lying position. Okay, then depending on the this thing also, if the patient is having tonsillectomy, then we'll keep him in a prone position. So by doing in that way, we are trying to prevent any form of aspiration, and we'll try to keep their airway clear. Okay, then we have to always check for the, then if the person have any fluids inside the mouth and all, we can do suctioning. Okay, suctioning actually it helps in removing the fluids which wherever it is present. Okay, so we can use a suctioning machine. Then for maintaining the respiratory function, we can also tell the individual to take a deep breath. Okay, deep breathing exercises. Then we can also administer oxygen if the person is having any difficulty in breathing, so we can give oxygen administration. Then mechanical support, this mechanical support actually we need it with the persons have any severe complications and all. Okay, then we have to observe for the time to time, we have to observe for the breath sounds, we have to assess for the respiratory rate. Okay, then also we have to also see for the psychological the fluid status. Okay, and under the fluid status, what comes is we have to see for the blood loss, how much is the amount, okay, how much of blood is being lost, what is then we have to see for the intravenous infusion rate which we will give to the patient. So what is the output? Output means how we can measure the output. So many aspects we can measure. Okay, it's like the patient blood loss we can see, then the patient whatever the urine output, that is very important. Okay, aspects. So and also we have to see for so many things like what is the hydration status, electrolytes. This is all similar thing which I have already said in the goals. Okay, so I will, and for the, okay, I will just, this will be a bit confusing for you all, so I will just directly move to the second one, but overall it will be same. Okay, so we have to maintain whatever I have said in the goals, so overall you have to maintain it in that way. Okay, so the care of patient under the effect of anesthesia. So similar, so immediately after the patient, he will be recovered, or he will be, after the OT it is done, then the patients he will be fully. Some of the patient he might not be totally. He will not be alert. Okay, so they will might be still having some form of loss of consciousness, or they are not semi-conscious. Okay, so we have to observe the patient until he recovers. Then if there is any form of noisy breathing, okay, if any form of noisy breathing if you can hear, then it is an indication that the patient might have some obstruction, okay, in the airway. Okay, or maybe because some fluids might have entered into the lung and it might cause some fluid aspiration. So immediately if that happens, what we have to do, we have to do suctioning. Okay, which will, suctioning is we will try to remove out the fluids whatever it is there, okay, in the mouth or in the thing. Then after that, if the patient condition it does not improve, then we have to call for the surgeon. Okay, and immediately we have to resuscitate, or we need to give the mechanical support to the client. Then we have to also administer oxygen if the patient is cyanose. Okay, cyanosis means it is the bluish discoloration of the skin. Okay, or which indicates that the person is having less oxygen. So if that happens, we have to administer oxygen. Then if the person is having a very weak steady pulse, so this also it might be an indication that the person blood pressure it might goes down, because maybe because of blood loss. Okay, even during that time also the person blood pressure goes down. So in that case, we have to make sure we have to give enough intravenous fluid. Okay, and we'll try to recover. Or if the amount of blood loss is very, if it is in a very large amount, then sometimes we might even require to administer blood. Okay, then put the side rails to prevent from fall injury, like I've also said. So those side rails needs to be put up, and never leave the patient alone. And also provide orientation, because immediately after the OT, especially the general anesthesia, the patient might have so many confusion. He might be totally unaware where of his surrounding and all. So you have to orient the patient like, okay, so you have done your surgery, so this is the time now, at present this is the time, then you're now in at present in recovery room. Okay, so you have, so all this thing you have to keep the patient orient, and we have to provide the patient with reassurance and all. Okay, so we have to provide psychological support to the client. Then administer narcotic sedatives. So these are narcotics and sedatives. These are those drugs which helps in inducing sleep. Okay, because some patient, because of the pain, they might have a loss of sleep or insomnia. Okay, so for that, to treat that, we sometimes we administer this narcotic or sedative drugs. Then unless the patient recovered, okay, their swallowing reflex, we should always keep the patient NPO, because if you allow the patient to eat orally, if they are still okay having the effect of anesthesia, then what happens, it might cause aspiration and all. Okay, so we should never allow. Okay, usually a patient who are on the general anesthesia, usually they first day and all, we never allow them to take anything orally. Okay, so so in order to maintain their fluid and balance, we always give intravenous fluid. Then provide psychological support to the patient. Okay, are you all clear till now? Yes.
Yes.
Yes, ma'am.
Yes, ma'am.
Ma'am.
Okay, this thing actually, you'll be more clear when you directly, if you come for hospital duty and all, you'll really see, okay, how a patient after coming back to from the OT, what the things they are doing, what the nurse will do. Okay, so practically when you will be going to the hospital, okay, because so you'll be posted only in recovery room and all. OT too, we don't send actually in first year, but in the second year only you'll get for OT room and all. But in the first year you'll be getting this recovery room and all. So during that time you'll be more clear with the concept of this post-operative care or recovery unit, and even for your pre-operative care, pre-operative care and all. This also in when the you'll similarly here also when your patient will be in the ward and all, in the own cabin. So even you'll be seeing how the nurse in charge, okay, so she will, before the day before the surgery, she used to prepare so many things, whatever I have informed before. Okay, all those checklists and all, they used to prepare. They will take the consent, okay, make sure all the dentures are removed. Okay, then clearing the bowel, bladder, they'll give enema, removal of hair. So all those things actually you'll be more thorough, okay, when you get to see it practically when you go for the hospital duty. Okay, so the time is up now. Please rejoin again, okay, after 5 minutes. Okay,
Okay,
fine.
ma'am.
Still some more few
Okay,
slides are
ma'am.
left. Okay.
Okay, ma'am.